I'm sorry once again. Video cut off. Ran out of time. But like I said, you would put the split gauze in there. Just make sure everything is patent, the straps are secured, and then apply the trait collar back on and ask them if they need anything. Call Light and Reach, and then document what you did and how they tolerate it. And then discard of everything. Okay. Now I'm going to demonstrate on trach suctioning. You would always want to identify your patient, explain your procedure, provide for privacy, wash your hands. When you walk in the room, of course, you want to introduce yourself, explain, wash your hands, assess the need for suctioning, maybe crackles in the lungs, maybe you can see secretions inside the trach, or maybe the patient is signaling for you to, or communicating with you, telling you that they need to be suctioned. Excuse me. So this is my trach and my little stoma. So you would want to, before you get started, go ahead and hyperoxygenate your patient 1 to 3 minutes or 1 to 5 minutes before we get started with your ambu bag, or then you would want to go ahead and get your suction ready. When you're suctioning a patient, you always want to make sure that the pressure on the suction is correct. You don't want to cause any trauma or anything like that, and it's usually between 80 to 100, I believe, or 80 to 120. So I'm going to go ahead and get my sterile. This is your little box. Just go ahead and pop it. Pop it, pop it. Just don't touch the inside of that. And set it down. And then you would have your saline, and go ahead and sterile water. Go ahead and pour that in there for suctioning purposes. And we're going to go ahead and put on our sterile And then I always want to wrap my tubing in my non-dominant hand. I don't want it to be flopping around. You would go ahead and connect this to the suction part. You want to test it, so you would put it in the water and just tap it, see if it sucks. And then if you are, you're good to go. Then you would want to remove the trach collar. As you're going into the stoma, you want to go quickly, but you do not want to suction as you're going in. Once you meet resistance, you want to pull back about 1 centimeter. As you're coming out, apply suction, tap, 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 rotate. Give them some oxygen. Wait about 1 minute or so. If they need to be suctioned again, go ahead and do it again. Before you suction again, you can always put it in the water to clear the tubing if you want. Like I said, as you're going in, do not suction. Once you meet resistance, pull back about 1 centimeter. Suction, tap, 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 rotate, 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 rotate. And then apply your trach collar again. You would document what you did, auscultate after. You always want to assess their O2 sats before, during, and after suctioning. You want to make sure you put that in your documentation, and just give them the call out and make sure they don't need anything else. And make sure their oxygen's on what it was before suction. And that is all. Thank you.